For today's program, we have information to aid employers in their efforts to respond to difficult employment-related issues and to address key questions that confront employers facing this pandemic. I'd like to thank the sponsors of this PowerUp webinar, who you see on your screen now. If you'd like to ask a question during the webinar, please use the Q&A button on your screen. We have a lot of attendees today, and we'll do our best to answer as many questions as possible. At this time, I'd like to introduce Lorinda Holloway. Lorinda is the office managing partner for Husch Blackwell's Austin office. She's currently serving as general counsel to the Chamber Board. Her area of practice is litigation and government investigations, and her clients are facing many of the employment law issues that the panel will be addressing today. Lorinda, take it away, and thank you so much.
Thank you, Dana, and thank you to the Chamber for all of its efforts to support the local business community like you're doing today. You know, as Dana said, this is an uncertain time for businesses really across the country, especially with more guidance that has yet to come out about the Families First Coronavirus Response Act, and with things changing daily. So today, our goal is to help all the listeners get a really good understanding of how your business can follow the new act and the guidance that is available at this point. That's really the best everyone can do. So if you're feeling nervous, like you don't have a handle on this, we're going to give you the basic tools and information that we know about today. And the reality is there's going to be a lot more information in the days and weeks to come. So today's presentation is broken into 3 parts with a different speaker for each part. First, we're going to have Tyler Hibler from our Kansas City office. He's going to give an overview of the Families First Coronavirus Response Act. Tyler's everyday work is defending businesses before the EEOC, the National Labor Relations Board, OSHA, and the Department of Labor. So he's been following the act really closely, and of course its related guidance. The second portion is going to be covered by Alan Kandel in our St. Louis office. He'll spend about 15 minutes digging into how the tax credits work and how employee benefits are impacted in this act. You know, the business world doesn't go around without lawyers like Alan. He helps put businesses, he helps them design, maintain, and defend their employee benefits packages and their executive comp plans, which is, of course, a highly regulated space. So Alan's really perfect to cover that portion. After Tyler and Alan's portions, we're going to pause for about 5 minutes and field some questions from you, the listeners. And then third, the final segment will be covered by Kevin Koronka here in our Austin Husch Blackwell office. Kevin's going to discuss the Department of Labor's guidance so far on the act. You know, Kevin's everyday work is working with employers on a really wide range of employment issues, from leave and accommodation concerns to discrimination and harassment matters to issues around non-competes and reductions in workforce. I personally call upon Kevin regularly when my clients have employment law matters, and I know he's very dialed in to all the issues we'll be discussing today as well. Then at the end, we'll wrap up our time together by fielding some additional questions from our listeners. So with that overview and introduction of our speakers, Tyler, I'm going to turn it over to you.
Thank you, Lorinda. Before we jump into the substance of the presentation today, I want to ensure that we address some key considerations. First and foremost, the information that's going to be provided within today's webinar is based upon our current understanding of the pandemic and the recent legislation that's passed. Understand that this is a very fluid situation surrounding COVID-19 and our country's response to the pandemic. Several laws have been passed in the last 10 days, which have dramatic impacts upon businesses and business operations. And just like you, we're still working to get our heads wrapped around these new laws and how they impact businesses. And as we're receiving additional and new guidance from the Department of Labor, we're making that available to our clients. So the information that's provided today is based upon our current understanding of the law. Additionally, I want to make sure that employers are aware that you need to be prepared for extended business interruptions. When asked back on March 15th, Dr. Fossey, who's the nation's leading expert on this crisis, stated that it will likely be several weeks to a few months where we can have interruptions and before we get back to normal life. To put this into perspective, I'm a massive sports fan. Most major sporting events are now pushed out until August or September for rescheduling purposes. So I know the Indy 500 was just rescheduled. The Kentucky Derby has been rescheduled for September. So from a business perspective, you should be prepared for extended interruptions. Kevin, I'm ready for the next slide. Thank you. Here's where we currently stand with the spread of the virus. As of last night at 6:53 p.m., there were 83,836 cases. To put this into perspective, I used a very similar slide in a presentation that I gave last Friday, and there were 14,000 cases at that time. So within a week, we've went from just over 14,000 cases to 83,000 cases. Of those cases, 39,140 are located within New York, and 6,876 are in New Jersey. And unfortunately, with our current number, we now have the title of being the world's leader in confirmed cases of coronavirus. On a local level, there are 1,563 cases confirmed in the state of Texas as of yesterday evening. For you locally in Travis County, as of last night, there were 119 confirmed cases within the state of Texas. Nationally, that places Texas about 10th on the list of states with the most confirmed cases. In regard to the nation's response to this pandemic, there's been several orders that have been issued. First and foremost, and this is important from an employment perspective, a pandemic was declared by the World Health Organization on March 11th. That provides employers with greater latitude in performing things such as temperature checks and medical examinations of employees to determine whether or not an employee on site may be exposed or demonstrating symptoms relating to COVID-19. On a national level, a national emergency was declared on March 13th. Restrictive traveling advice was provided by the CDC on March 16th, and that's when we are limited to avoid gathering in groups of 10 or more. Since then, things have dramatically increased, primarily on a state and local level. All 50 states have now declared a state of emergency. While Texas has not issued a statewide mandatory stay-at-home order, several local, either county or city municipalities have ordered residents to shelter in place. That includes you folks down in Austin. As of March 23rd, a stay-at-home work safe order was issued. On that note, important for employers to consider is if you have operations that may be either out of state or outside of the Austin area, you're going to want to consider and look at the local guidance regarding stay-at-home orders. For example, like you guys up here in Kansas City, neither Missouri or Kansas has issued a statewide stay-at-home order, but the Kansas City metropolitan area, which straddles both state lines, has issued stay-at-home orders based upon counties in the metro. So if you are operating outside of just the Austin area, make sure you're keeping advised as to what the stay-at-home orders may be for your workforce. Recent legislative actions, and this is truly the focus of today, is the Families First Coronavirus Response Act. And that's quite the mouthful. So as we're talking today, I'm going to refer to that as the Families First Act, just for brevity purposes. That really contains two portions of the act which affect employers that I want to discuss on a broad view. And that is first, the Emergency Family and Medical Leave Expansion Act, which I'm going to refer to as Emergency FMLA leave. And then you have the Emergency Paid Sick Leave Act. And I'll refer to that as simply Emergency Paid Sick Leave. Now, the Emergency FMLA allows employees affected by school closures, and that's the sole qualification to be eligible for protected leave. The paid sick leave, in contrast, contains 6 categories of qualifying events and permits employees 2 weeks of paid sick leave, regardless of how long they've been employed. These acts, based upon recent information distributed by the Department of Labor, go into effect on April 1. Initially, we thought it may be April 2, but to coincide with the monthly calendar, the DOL has indicated April 1 will be the effective date. Additionally, in addition to these national acts, we want to make sure that you're aware that several states began considering similar laws to assist affected employees. I know Colorado has passed laws. New York has passed laws, for example. Locally, down in Austin, my understanding is that your paid sick leave still remains in legal limbo based upon some challenges that are in place. So make sure you keep advised. And if you have questions, I'd refer you to Kevin on those issues. So the first prong of the Families First Act that we're going to take a deep dive into is the Emergency Family Medical Leave Expansion provision. This provision of the law provides 12 weeks of leave for an employee if they are unable to work, and that includes telework. So if an employee is working remotely, it's only if they are unable to do that due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable. We've received lots of questions regarding the applicability of this provision to that extent. When is somebody unavailable? And you're going to have to work with employees to determine that. For example, if an employee is working from home in a telework situation, but there is another parent in the household who is not working and is free to care for the children, that may not be a bona fide need for the leave based upon that situation. In contrast, if it's a single parent at home with several small children, that likely is a bona fide need based upon the need for childcare, even if they are under a telework situation. To qualify for this leave, an employee must have worked for the employer for at least 30 calendar days. And this act applies, and when I say this act, the Families First Act in total applies to employers with fewer than 500 employees. And that's private employers with fewer than 500 employees, which makes no attempt to distinguish between either nonprofit or for-profit organizations. So if you are a private employer with fewer than 500 employees, regardless of status regarding profit or nonprofit, you're going to fit within the qualifications of the Act. The first 10 days of this FMLA leave may be unpaid. After that, the employee is entitled to 2/3 of their regular pay. This is not to exceed $200 per day and $10,000 in the aggregate. An employee is entitled to return to the same or equivalent position unless an employer has fewer than 25 employees. Then that is not required if the employer cannot accommodate the request to return to work. I also want to note that there are exceptions within the Families First Act for various employers and specific employees. Specifically, the Secretary of Labor can exclude healthcare providers and emergency responders from the leave provisions specified within this act. The phrase healthcare provider and emergency responder has yet to be defined by the Secretary of Labor. So there is a little bit of confusion between, does the phrase healthcare provider limit itself to the traditional FMLA definition of healthcare provider, like doctors, individuals who can actually make diagnosing decisions, or is it expansive and extend to nurses and CNAs and people of that level? So it's a little unclear. Our view is that this is likely going to be extended broadly and interpreted broadly based upon the nation's need for a response to the COVID-19 crisis. Additionally, employers under 50 can be exempt from the act where compliance would jeopardize the viability of the company. The Department of Labor has issued little guidance on that. Kevin's going to jump into that issue a little bit further later on in the presentation, but I do want to make that known that if you are an employer with less than 50 employees, there is the potential for you to be exempt from the act based upon the economic viability of your company. Next slide. Great. The next prong of this act is the Families First Act is the Emergency Paid Sick Leave Act. And this is a little bit more complicated than the emergency FMLA leave, which is provided and limited only to child care issues. So under the Paid Sick Leave Act, this again applies to the same employers with fewer than 500 employees. But unlike the emergency FMLA leave, there is no minimum tenure of employment for an employee to be eligible. They are eligible for this leave day one of employment. Under the Act, employers must provide employees with 2 weeks, 10 working days of emergency paid sick leave benefits to be used for COVID-19 related absences. And determining what that means in terms of rate of pay for 2 weeks, for full-time employees, this means 80 hours. For employees who work a part-time or regular schedule, you're looking at the average number of hours they worked per week for the 6 months prior to taking the paid sick leave. If an employee has worked less than 6 months, you're going to look at the number of hours they would be anticipated to work for a period of 2 weeks while employed. As indicated, this leave is immediately available for use by the employee as of April 1. And an employer cannot require employees to exhaust other forms of paid leave before using this new COVID-19 paid leave. So if you have a sick bank, which is available for employees to use, and they have remaining days in their original sick bank, this COVID-19 paid leave tacks on an additional 10 days based upon the qualifying events. As with most employment laws, employers are not permitted to discriminate or retaliate against an individual taking leave under this act. So what are the qualifying events? There are 6 of them, which have been specified by the Department of Labor. 1, the employee is subject to federal, state, or local quarantine or isolation order for coronavirus. There is a little bit of confusion regarding that language in light of the stay-at-home orders which have been put into place, and whether or not stay-at-home orders qualify as a quarantine or isolation order. We're still awaiting guidance from the Department of Labor specifically on that issue. If you have questions or concerns, I encourage you to put those into the question box, and we can answer those as we move along today. Additionally, the second category is the employee is advised by a healthcare provider to self-quarantine. Third, the employee is experiencing symptoms of coronavirus and seeking a medical diagnosis. Fourth, the employee is caring, and notice this language, for an individual. That does not have to be a child. If you are caring for a loved one, a relative, a friend, if you are caring for an individual who's under quarantine or isolation order that's been advised to quarantine, you can qualify for this leave. 5, the employee is caring for a child whose school or childcare has been closed, the same qualifying events for the FMLA leave. And 6 is a broad catch-all which has not yet been defined by the Department of Labor, which is the employee is experiencing any other substantially similar conditions specified by the Secretary of Health and Human Services. We're not quite clear what that means yet, but we're awaiting guidance from the Department of Labor. So what's the rate of pay associated with each of these leaves? As I indicated, there's a different rate of pay for each leave. First 3 categories, as identified on this chart, are regular rate of pay, not to exceed $511 per day, and $5,110 in the aggregate. The bottom 3, and this includes caring for a child whose school has been closed, is 2/3 the regular rate of pay, not to exceed $200 per day and $2,000 in the aggregate. You can go to that next slide. So looking at this over a time frame of 12 potential weeks for leave, the first EPLSA box that's in dark blue represents 2 weeks of paid leave that an employee can take under the Sick Leave Act for one of those 6 reasons. The EMFLA is the Emergency Family Medical Leave portion. Again, the first 2 weeks, the light blue portion, could be unpaid, and the remaining 10 weeks are paid at that 2/3 payment level. These can run concurrently. So you can have a situation where if an employee's school, their child's school has been closed and they have to stay home to care for that child, they can receive pay continuity for up to 12 weeks. Some last notes and considerations for employers. The employee's ability to use paid sick leave for these purposes, and this is the paid sick leave, ceases upon termination of the qualifying event. The leave provided under this law does not carry over year to year, and any unused leave does not need to be paid out upon termination. Employers are required to post a notice in the workplace, and that notice has now been published by the Secretary of Labor. And I believe there's a link to that notice that's going to be provided later on within the presentation. Additionally, a failure to comply with the new paid sick leave law will be deemed a failure to pay minimum wages under the FLSA. Now, there is a 30-day moratorium on enforcement of this law, but employers should quickly get up to speed and in compliance. With that being said, I'll turn it over to Alan, who's going to jump into some of the tax benefits and credits under the Families First Act.
Let's see. Thank you, Tyler. So I'm going to speak about what many of you are interested in hearing, which is the tax credits that are available for employers that are required to provide the pay for sick leave or for caring for somebody else. And we've gotten a number of questions having to do with how do you apply for the credits. The answer to that is pretty simple at this point. I don't know. The IRS has not yet published guidance about how to apply for the credits. The IRS did issue a statement on March 20th, which said that guidance will be released next week, which would mean this week, but I haven't seen it, at least before I got on this webinar. And as Tyler said, the benefits that employers are required to provide do not go into effect until April 1st. And so I would expect that the tax credits will be available beginning April 1st. So perhaps early next week, the IRS will come out with guidance, which we don't yet have. The tax benefits for employers are for both kinds of payments, both for sick leave and leave for caring for somebody else who is sick, or children whose schools are closed. The idea is that employers will get a tax credit equal to 100% of the amounts that the employers are required to pay under the Act, so that employers won't be out of pocket. It's not only for the amounts that the employers pay as wages to employees, but it's also health insurance costs. Will be the employers can recover that through the tax credits. Now, I should mention also that these credits are all part of the Act, but there have been some changes that the IRS has made in its own guidance that are incorporated in the CARES Act. Now, the CARES Act was passed by the Senate on Wednesday night. The House is considering it now, unless the House has voted yet. And so what we're describing in the slides has some updates. One of the things in the IRS guidance is that employers will be able to file for accelerated payments for the qualifying leave payments. This really goes beyond what the statute says, as it was passed a couple of weeks ago. But the IRS has said that employers don't need to wait until they file their returns, the 941s for the employment taxes, but the employers can take and wait for the IRS to issue payments in response to some forms that the employers fill out, but instead the employers will be able to not pay employment taxes to the extent of the credits that they're entitled to for these payments to employees. As Tyler mentioned, small businesses will be eligible for an exemption to the leave payments if they can demonstrate that payment of the leave will threaten the viability of their business, and the Department of Labor, which is responsible for providing guidance on that, has not yet provided that guidance. The Department of Labor has also said that they will delay for 30 days any enforcement action against employers that act reasonably and in good faith to comply with the act. Yeah, let's leave on this slide. The press release is inconsistent with the act in some respects. And one of the inconsistencies is that the act itself discusses the tax credit against the employer portion of Social Security only, which is the 6.2%. There's an employer portion, an employee portion. The notice that the IRS published last week says that the payroll taxes that the employers can keep include withheld federal income taxes, the employee share of Social Security and Medicare taxes, not only the employer portion and not only Social Security, but also the Medicare tax, as well as the employer share of Social Security and Medicare tax. So this really goes beyond what the statute says, but also the CARES Act, it seems, has some provisions that would incorporate the guidance that the IRS provided. Something to keep in mind is that while the requirements for paid leave apply to employers of less than 500 employees, large employers are still eligible for a tax credit under Section 45S of the Internal Revenue Code for paid FMLA leave. Can you go to the next slide, please? Currently, the act as it is on the books now applies to payments for sick care, child care, qualifying leave payments provided by employers between April 2nd, actually that's been administratively changed to April 1st, and December 31st this year. So it applies only to payments made this year. I had mentioned that this applies to employers that have fewer than 500 employees, both on the tax credit side as well as on the benefit side. The credit for sick leave is determined like this, and it's a little bit complicated, but bear with me. Employees are eligible for 2 weeks of paid sick leave at 100% of the employee's pay. I should mention that this applies also to self-employed individuals. So it applies not only to employees of employers, but members of partnerships or LLCs. This also applies to them to the extent that they would qualify. And the qualification, as Tyler had mentioned, is that the individual is unable to work because of the COVID-19 quarantine or self-quarantine, or somebody who has the symptoms and is seeking a medical diagnosis. And for people who are eligible for this, the sick leave tax credit for sick leave payments is at the employee's regular rate of pay up to a maximum amount of $500 per day and $5,110 in the aggregate for 10 days. So the amount of the credit equals the maximum amount that the employer is obligated to pay. Employees also, as Tyler had mentioned, are eligible for 2 weeks of paid sick leave, but 2/3 of the employee's pay if the employee is caring for another individual. And this is 2/3 of the employee's regular rate of pay up to a maximum of $200 per day or $2,000 in the aggregate. And then again, as I mentioned before, employers are entitled to an additional tax credit based on the cost of maintaining health insurance coverage for eligible employees. As Tyler had mentioned, employees may receive up to an additional 10 weeks of pay for expanded family and medical leave at 2/3 of the employee's pay if the employees are unable to work due to a need to care for somebody. And this is equal, again, at 2/3 of the employee's regular pay up to a maximum of $200 per day or $10,000 in the aggregate. And again, the employer is able to receive a tax credit for the cost of maintaining health insurance coverage during this period. The Act, as I had mentioned, says that the employers are entitled to a tax credit. Now, ordinarily, an employer would apply for a tax credit and would receive the payment for it. But as I had mentioned, the IRS has taken a position which will be incorporated into the CARES Act, assuming that is passed and signed into law, that instead of having to wait for the process, employers will be able to just reduce the amount of payroll taxes they pay by the amount of the credit that they are due. If the amount of the payroll taxes that they would otherwise pay is greater than the amount of the credit, then the employer just pays a reduced amount of payroll taxes. If the amount of payroll taxes is less than the amount of the credit, then the employers will be entitled to a refund, and they'll have to apply for that. And the IRS has said that at least in this circumstance, the IRS is really our friend, and that they are going to process these refund requests on an accelerated basis. So I'd like to touch on, I'd mentioned the CARES Act a couple of times. I'd like to touch on some provisions that are in the CARES Act to keep an eye on, because these will affect many employers, if not most employers. The first is that the CARES Act provides for allowing employees to take in-service withdrawals of up to $100,000. Now, these in-service withdrawals for an employee in a 401k plan or other defined contribution qualified plan would come without a 10% penalty if the distribution is before the employee reaches age 59 and a half. Ordinarily, a 401k plan is not allowed to pay an in-service withdrawal before an employee reaches age 59 and a half, and that requirement would be waived for a qualified individual who is affected by the coronavirus pandemic. The taxation on these withdrawals can be spread over 3 years, and the withdrawal can be paid back to the plan once the employees gets his or her feet back on the ground within 3 years after the withdrawal is taken. The CARES Act provides for changes to the rules for plan loans, which can go up to $100,000 as opposed to the current $50,000 limit, or up to 100% of the vested balance if that's less than $100,000, as opposed to 50% of the vested balance, which is what's allowed currently. It also provides for an extension of loan repayments on loans from a qualified plan to a participant for 1 year. The act would have a moratorium on minimum distributions for 2020, and it would provide a moratorium on required contributions for employers to single employer sponsored defined benefit plans. And a couple of other provisions in the welfare plan area include that there's been some concern about the requirement for coverage of telehealth services for employees who have coverage under a high deductible health plan and have an accompanying health savings account, an HSA, because if any benefit that is provided under a plan that is not specifically permitted in the statute can disqualify an employee's eligibility to participate in the HSA. The CARES Act would fix that problem and would still allow an employee who's getting telehealth services as provided under the Act to be able to continue contributing to an HSA. And the other significant change in the welfare plan area is that over-the-counter medical products would be able to be paid out of an HSA or a flexible spending account. The Affordable Care Act provided that over-the-counter medical products could not be paid out of an HSA or an FSA.
So Alan, this is Lorinda, and I'm going to jump in. You guys have covered, you and Tyler both have covered a lot of information. We're going to pause here and just hit quickly a couple of the questions that we're getting in from some of our listeners. And the first one is for you, Alan. And here's the question. If an organization chooses to pay 80 hours of full-time pay instead of the 2/3 of pay for employees who stay home with their children due to school closures, does that still meet the Families First requirement?
Yes, it does. The 2/3 of pay provision is a minimum. It's not the maximum. And so an employer can pay more than that amount. The tax credit would be limited to 2/3 of the employee's pay.
Okay, great. And then the second question from some of our listeners, and pardon the garbage truck sounds in the background if anybody hears that. The second question is for Alan. Alan, is there any merit to a business like temporarily shutting down and then reopening once the crisis is over? Is anything in this act, if someone was to pull away and do that and just hit pause on their whole business and then resume, how would you see that playing out? And is that a good idea?
Yeah, so it's a great question, but I would say that the decision on closing down or not should not be driven by the possibility of getting tax credits or some of these other requirements. It really needs to be driven by the business needs. Some businesses can no longer function because they're not allowed to be open anymore. Restaurants are, in most places are not allowed to remain open, or at least in many places, and serve to the public. But other businesses, if it depends on how this affects the business. And again, I think it should be driven by the economics of the business and business needs as opposed to what's provided in the Act.
Got it. Okay, those are great observations. I think we're going to turn now to our last segment with Kevin Koronka. Kevin is going to address the Department of Labor guidance that has come out so far with respect to the Act. And Kevin, if you have any additional thoughts teeing off of what Alan shared in response to that last listener question, please feel free to weigh in on that as well.
Sure. Thanks, Lorinda. I will cover that a little bit later in the slides. There is some consideration to take under the Families First Act, but I agree with Alan. It's definitely a case-by-case scenario, and but we'll touch on that a little bit further. So yeah, on Tuesday afternoon this week, the Department of Labor released its first set of guidance on this new set of laws. We also received some additional updates from the Department of Labor late last night, early this morning, which we'll also discuss. This initial guidance from the DOL includes a separate fact sheet for employees, a separate fact sheet for employers, as well as a question and answer document, which is what we're going to walk through in further detail for the rest of the presentation. You'll see it does clarify some things, but it is far from clarifying everything. On the PowerPoint deck, which you guys will have access to, there are hyperlinks to each of these documents. You can also find them on the Department of Labor's website. The first 14 questions and answers were posted on Tuesday. There were additional questions 15 through 37 posted late last night. We don't have time to go over every one of the 37 questions and answers today. So I strongly encourage you guys to read the whole question and answer document. Also check back frequently, as the Department of Labor has said it's going to be updating that document on a rolling basis. But we will touch on the questions and answers that I thought were most interesting or most important. The first one on the slide here, Tyler's already addressed. We initially thought that the Act was going to go into effect on April 2nd based on when it was signed, but the DOL now says April 1st, which is likely due to their desire to have this line up neatly on a Q2 basis, starting on April 1. Second question is a question that we've been getting from a lot of clients, and I've seen a lot of you have asked similar questions through the Q&A today. How do you count employees across multiple affiliated entities? So the question is, if you're an employer and let's say you've got three different entities, two of them have 200 employees each, one of them has 150, for a total of 550 employees, can you count all those employees together to exceed the 500 employee threshold, thereby making you not have to provide these benefits to employees? So the Department of Labor here clarifies that the employees you should count are full-time employees, part-time employees, temps, even day laborers that you hire through temp agencies. You shouldn't consider independent contractors in the count. You probably shouldn't consider employees who work in other countries because they wouldn't be eligible under FMLA typically. But how do you count these entities together? Can you do it? And to do that, we've got to look at traditional FMLA and FLSA principles, which honestly lead to some potentially inconsistent results under each act. I'm going to walk through these tests, but these are very, very complex analysis. I can't give you a black and white answer as we sit here today. If you have questions about whether your business qualifies under either test for a potential exemption, I'd strongly encourage you to contact your employment lawyer and talk to her or him about this. But the first test there under EFMLA is the integrated employer test. So if you look at all your different entities, two or more entities, to determine whether they're an integrated employer, where you could potentially count all employees together, you look at those four factors: common management, operational interrelation, centralized labor control, is there common ownership or financial control between the entities. The second test under the EPSLA, the 2-week paid benefit, is that law is administered or governed under the FLSA, and that uses the joint employer test, which looks at the control between the two entities over the work or the working conditions of the employee. You can be separate and distinct legal entities, separate ownership, separate management, separate facilities. But if you meet that joint employer test, you could potentially count all your employees together for purposes of that 500 employee threshold. So this is another question that I saw come in, and I want to hit on it. If you're a business with 50 or less employees, you can qualify for the exemption. How do you qualify? Do you have to apply? What forms do you need to send in? I think you guys have heard today, there's still a lot of unanswered questions on who's going to qualify for that. But the guidance we're receiving right now is the DOL is saying you don't have to send any documentation to them. Just document the reasons why you think your business meets the exception. I think there's an open question here as to whether you'll ever be required to provide that documentation if you're one of these small employers to the DOL. But I would certainly recommend holding on to it in the event they ask for it or you're audited later. If they think you're playing loose and fast with this exemption, they may take a closer look. So make sure you hold on to all documentation in case this question comes up in the future. Question 6, do you have to include overtime pay to employees? Tyler touched on this as well, but the DOL has made it clear in this guidance that whatever the employee was normally scheduled to work, that is how you calculate their rate of pay. The one exception there is what they've talked about under the FMLA, where the DOL gives this example in question number 6. If you have somebody who works 50 hours a week, could they get 50 hours the first week and 50 hours the next week? No, it's an 80-hour cap. It would be 50 and 30. Question number 9 is somewhat related there too. Can an employee double dip and take 80 hours for one reason under FMLA, and then if they have another qualifying reason later, can they take additional leave? DOL says no. Once that 2 weeks is exhausted, that's it. But like Tyler said, keep in mind they may qualify for an additional 10 weeks under FMLA depending on their situation. So question number 8, what's an employee's regular rate of pay? We know we're supposed to pay them their regular rate of pay under this set of new laws, but how do we calculate that? For most employees, Tyler touched on this too, that's going to be their average pay over the last 6 months prior to the day that leave is taken. But if you have employees who work for you for a shorter than 6 month period, you take their weekly average. Really important from this piece of guidance to me is the fact that the DOL says commissions, piece rate work, tips, those sort of things have to be considered in your calculations. So if you have somebody who has a low base salary but gets paid the bulk of their pay on a commission basis or some other basis, restaurant employees with tips, certainly you'll need to consider their total take-home pay when you're calculating their regular rate of pay, not just their base rate. Question 12, remember FMLA, like Tyler said, is only for childcare reasons due to COVID, school closures, but it does not require other types of traditional FMLA leave to be paid. The obligation does not change and shift on to you guys. It's you just pay under FMLA for the childcare exception. Question 10 is similar to question 9 and addresses the intersection, the potential overlap between the two acts. Even though an employee may have a situation that qualifies them for leave under both acts, like Tyler and Alan I think said, the DOL has clarified here, they only get a maximum of 12 weeks. And then there at the bottom, they then again clarify again. I think there was some initial confusion over this, whether or not FMLA covers other sorts of paid leave, but it's only available for children's school and child care closure situations. Question 11. Can you deny paid leave under the Paid Sick Leave Act from April 1st forward if you've already paid similar paid leave to employees out of work prior to April 1st? And DOL says no matter how generous you've been, no matter what you did in terms of paid or unpaid leave prior to April 1st, if your employees qualify, they're eligible. This is a new benefit. Question 31 below is somewhat similar. Can an employee use accrued PTO under your policy concurrently with one of these types of leaves? The answer there, high level, is you can agree to permit it, but you cannot necessarily require it. 32, 33, and 34 all sort of follow up on question 31 that we just talked about. Answer 32 says you can permit the use of additional available leave, PTO or sick leave, that they might otherwise be entitled to under your plans or policies, but you cannot require them to use existing leave to supplement their benefits under the EFMLA or the EPSLA. But again, like Alan said, if you do decide to sort of true them up in that 2/3 scenario and pay them that additional third of their normal rate, you're not going to be eligible for a tax credit, and this guidance now makes that clear from last night. Question 33 and the answer again emphasizes that the use of additional leave is the employee's choice, and I'm talking about additional PTO or sick leave they are otherwise entitled to. Employee's choice, not the employer. And then 34, it's getting a little repetitive here, but it clarifies if you pay more than the acts require, you're not going to be entitled to an additional tax credit. 23 through 28 all have to do with, and these are all answers that came out last night, all have to do with the impact of layoffs, furloughs, and closings and related requirements of the Act. High-level summary there for all these questions. If an employee is laid off or furloughed prior to April 1st, they're not eligible for paid sick leave or EFMLA. They would most likely be eligible for unemployment. This is true whether you close for economic reasons or due to local government quarantine or isolation orders. If an employee, if you close your facility after April 1st, and the employees are no longer working for you, but then they subsequently request to take paid sick leave, this clarifies you don't have to provide them that. The one exception that they highlight here in 25, let's say you're open on April 1st, somebody takes paid sick leave on April 1st, but for some reason you're required to close down on April 7th. You would have to provide them sick leave benefits under these acts for April 1st through April 7th, but not after that because you're going to be closed down. 15, I didn't put the answer on there because it's a very long answer, but I wanted to point out that both questions 15 and 16 deal with what records you should keep and what the employee needs to provide to you. Names, reasons for leave, a statement why the employee is unavailable to work, whether telework is not an option, that sort of thing. Definitely go and look at the answers to these to questions 15 and 16 about what those requirements are, because you're going to want to make sure you comply with them. 19 deals with an employee teleworking. And I think we touched on this a little bit, but if you permit telework, but the employee is not able to perform telework because of one of these qualifying reasons, most likely childcare issues, then even though they're eligible to work from home, if they can't work from home due to lack of childcare, then they're still going to be eligible for these benefits. 20 and 21 have to do with the taking of intermittent leave, intermittent EFMLA leave. High-level summary there is intermittent leave is going to be required under EFMLA if an employee is teleworking. The rationale there is if you have somebody caring for their kid at home during normal working hours, but they're able to telework for you, for part of the day while they do have childcare coverage through, a spouse or a family member, they could take intermittent leave under the EFMLA in that situation, which means, not taking a whole day off. Finally, the workplace posters, I got 2 more slides. The workplace posters that Tyler mentioned, that's a link where you can find the poster that you're required to post. Department of Labor, that second link, has also put out a frequently asked questions on the posters requirement. Those 2 bullet points I thought were the biggest key takeaways from the FAQ. You're required to post the poster on your premises, but if that is impossible for a variety of different reasons, if you're closed down, if you can't go in, the DOL has said it's sufficient to email it to employees, to post it on your website, to post it on your intranet. But if you can do both, and certainly if you have employees, working at the office, you should post it wherever you post your normal employee notices, break room or whatever that might be. Finally, the DOL says you don't have to give notice to laid off employees. That's consistent with what we just talked about, that, that people who are laid off prior to becoming eligible for some of these leave packages are not eligible to participate. So finally, a little bit of good news. The DOL says on March 24th, there's going to be a 30-day grace period here. I initially thought that was going to be from April 1st to April 30th, where, so long as you're, making reasonable good faith efforts to comply with the requirements under the new laws, you wouldn't be, subject to DOL enforcement if you stub your toe on compliance. This is not really 30 days from April 1, though. This new guidance says that it's, March 18th through April 17th is the sort of grace period, and that runs from when Trump put the signed the law into effect, in 30 days from that. But so long as you're making reasonable good faith efforts to comply with your requirements in these new laws, if you stub your toe, especially on one of these issues that doesn't have a clear answer right now, once the clear answer becomes apparent, so long as you fix the problem as soon as you can and comply with these other issues in the enforcement guidance, you're not going to be subject to enforcement authority. So with that, I'll turn things back over to Lorinda, who I think is going to close us out, and if we have time, moderate some additional questions and answers.
That's great. Thanks, Kevin. We do actually, I understand we can run over by about at least a few minutes, 5 or 10 minutes over our allotted time to 1 o'clock. So I'm gonna pitch to you, Kevin, 2 or 3 kind of, I would call them in the weeds questions about material that you were covering related to Department of Labor guidance. And then I'm going to have what I'll call a zinger question based on some things that transpired while we've been in this webinar. So the first question for you, Kevin, is from one of our listeners: how do we confirm someone's really COVID-19 sick or has a family member really sick to meet the ER paid sick leave criteria?
Sure, and that's a really good question, and also a question that I've been getting from lots of clients, because most of you guys may have employees out there that you think might abuse medical leave or might take time off when they're not really sick, and this has come up frequently. The EEOC and the CDC guidance at least say that you shouldn't, maintain a hard and fast rule that you're going to require a doctor's note to prove that that's the case, due to the strain on the healthcare system that this crisis has presented. But at least the guidance that I've been giving, and Tyler, let me know if you feel differently, is just because that's guidance by the EEOC doesn't mean you can't still insist upon a doctor's note. But consider it on a case-by-case basis. If it's an employee that you don't have any reason to suspect is abusing leave, treat everybody the same to the extent you can. But if you think you need a physician verification, I think you can still ask for it.
Great. Alan, did you have anything you wanted to add to that question? If not, I've got another question ready.
My recollection is that the Act allows for self-certification by employees. And I was just starting to thumb through the Act as Kevin was speaking, and I couldn't put my fingers on it, but that may be something that can be relied on.
Okay, and that might be something we'll give more crystal clarity to in some follow-up, I think, answers to the questions. We have a lot of listener questions today that have been posed, and so I think after this webinar ends, we'll be providing some of those answers through the chamber for everybody's benefit. So we'll circle back on that one. The second question for you, Kevin, is from one of our listeners: if we are partially paying employees while the shelter-in-place order is in place, can they activate the FMLA since they're not going to be doing any physical work?
No. Well, if they're not doing physical work, but they're paying them anyways.
That is the question.
There's some guidance from last night that talks about situations where you pay somebody when they're teleworking and whether they're eligible for benefits like that. That's an interesting question. I would guess if you're paying them a half rate anyways, that's probably going to, that question's not been directly answered, but if you pivot off of some of the other guidance that's been given, my best guess is they'd be disqualified from those benefits because they are receiving pay. But if they're not receiving 100% of their normal pay, they could apply for unemployment benefits to bridge the delta.
Got it. Okay. Alan, I think this will be our final, what I would call kind of in the weeds question. This one can be for you or Kevin. And this is again from a listener, what if the employee, him or herself, is positive for the virus and is the one being cared for, either at home or in the hospital? How does that play out?
Well, the Act provides for coverage for, both of them do for, well, EPSLA provides for 2 weeks pay for an employee to take off to care for a family member or an individual, like Tyler said, that has a COVID related issue. EFMLA is only for childcare, so wouldn't necessarily apply. But I think you'd also want to look under traditional FMLA principles and determine whether or not there's any additional unpaid leave that person might be qualified for.
Great. Okay. And I am going to post what I previewed. Might be a little bit of a zinger question. I don't think it's a terribly hard one, but a new one and one that no one's discussed before this webinar. But while we were in the webinar, the House did pass the historic $2 trillion stimulus package. And of course, that's going to include payments, checks from the government going directly to certain individuals throughout the country. And I guess my question for any of you that want to speak to it is, does anything in the Act and that we've been discussing today, does anything in this new stimulus package, do you think that would change what employers are supposed to be doing under the Families First Act? And Kevin, I'll let you speak to that one first.
Absent something specific in the Act that says that, I don't think so. I know that there are provisions in the Act that provide for supplemental unemployment benefits on a federal level to make up some of the gaps that may be there between normal wages and the state unemployment max. I mean, the interplay there between the federal benefits and the state level benefits may create an interesting issue, but absent some specific, language in the new law, which, obviously I've not had a chance to read yet, I think you still have to comply.
Yeah, that was my overall thinking. Alan or Tyler, do you have anything you wanted to add different than what Kevin's observed?
Well, I would just say that some of the ideas that I had spoken about earlier, referring to what's in the CARES Act, assuming it was enacted as the Senate passed it, now are law, at least once the president signs it, and I think he was going to sign it immediately. That's all now law. So the IRS noticed that employers would be able to just withhold from their payroll taxes the amount of credit that for payments that they make. Presumably that's law now. That the changes to the benefit plans that I had mentioned, that's all law now. So I don't think it changes what we discussed today, but it's a change from the Act that we were really focused on.
Got it. Okay. Well, as everybody can see, I think we'll close things out now. It's a little bit after 1 o'clock. This last slide has a number of important resources for everyone. And of course, we have included a link to the Husch Blackwell coronavirus toolkit in there, but of course, whatever employment lawyers or firms that you're used to working with. They may well have their own coronavirus related resources on their websites too. Of course, reach out to those folks as well. And again, I think we'll be providing follow-up answers to any questions that we did not get to today. And so with that, thank you again to the Chamber and for supporting our local businesses with this kind of information and for the opportunity for us to share this with you today. And with that, I'll turn it back over to Dana.
Thank you so much, Lorinda, and thank you to the Husch Blackwell team. What a great presentation. We will post a recording of this webinar with the slides. Thank you all so much for joining us today. Unless you posted a question anonymously, we will do our best to follow up. Please be on the lookout for our webinar on Monday with Congressman Michael McCall to talk about the CARES Act that just passed the House. Please continue to shelter in place, wash your hands. This is the only way we can flatten the curve. So thank you so much and talk to you soon.